Are you concerned about rising healthcare costs? You're not alone. The average Affordable Care Act premiums are increasing by around 7% for next year. So let's go ahead and talk about what that is, what that means, and how that's going to impact you. Let's start with the basics. What are ACA plans? So the Affordable Care Act was signed in 2010, and this is essentially, a lot of people call it Obamacare. And what this did was create a lot of individual health insurance plan options for individuals. And most people purchase these plans via healthcare.gov. Some states have their own exchange, but very similar to that. And these plans provide health coverage to individuals, families. Essentially, if you don't have employer coverage and you're not yet Medicare eligible, or you're over the age of 26 and you can't be on your parents' plan, maybe you're an independent contractor, or there's just some reason why you don't have access to health insurance, the Affordable Care Act or these ACA plans are the option for you. We also call them IHIP plans, which means Individual Health Insurance Plan. Simple as that. All right, so now let's talk about that 7% and what that means for you. So the median proposed increase for 2025 was 7%. Obviously, this varies by state where you live, which plan you're on, the individual plan, the insurance company, et cetera. For example, Kaiser Family Foundation, they said there's 324 national insurers for the ACA plans. And the range of those plans for next year in increases in premium is between 2 and 10%. The good news is that of those 324 that they mentioned, they indicated that 50 insurers would actually be reducing premium for 2025. So I hope that most of you are on one of those 50 plans. One of those 50 insurance companies' plans. And 84 would actually be increasing premiums by around 10%. So truly kind of based on where you live and your situation, it will vary. But on the whole, just expect that, like everything else in life, that it will probably increase. The 7% is a good guide, but just plan for something around that. So why are we seeing this increase? Well, I think most of us know that everything is increasing these days. So there's really 3 contributing factors worth mentioning. The first, like I just said, everything's going up, is inflation. The second is hospital consolidation and workforce shortages. And the third, prescription drug costs. They're just increasing dramatically. So let's talk about those 3. Okay, so first and foremost is inflation. We recently did a video on the cost of living increase for Social Security for 2025. So that might be worth taking a look at. But I think we all know that everything is costing more right now. You go to the grocery, everything just continues to increase in price. And that said, the cost of healthcare continues to rise. We have to pay the healthcare workers more because everything else is increasing. And just as the insurance companies spend more on the healthcare, they're going to look to you to pay more for premium. So just generally, the economic inflation is driving these premium increases. All right, so now the second is hospital consolidation and essentially just healthcare worker shortages. So there is, as hospitals continue to merge or acquire physician groups or things like that, the negotiations that they have with the insurance companies, they have a lot more leverage. We're looking at less hospital systems and more large hospital systems. So they are looking for larger reimbursement rates from the insurers. That said, as these groups continue to grow, we are seeing they're having a harder time finding employees and nurses and doctors and just people to work in the hospital system. So therefore, they're going to have to continue to increase what they pay those folks. So just kind of looking at that from a medical perspective and how that impacts the cost of your healthcare, it has cost more money to the insurance companies. And again, they're then passing that along to you. So the third contributing factor that I want to mention is prescription drugs. The prescription drugs have typically been one of the biggest drivers of increased healthcare expenses. We all see things like the weight loss drugs, diabetes drugs, just various things. You can't turn on the TV and watch a show without seeing several different prescription ads. And the thing that's really interesting about these prescription drugs is the drugs that really cost the most and drive up healthcare expenses, we generally see a small population taking them. A good example of this, and one personally for me, because I do a lot with the Alzheimer's Association, is the Alzheimer's treatments that have been rolled out over the last few years. And these treatments are typically focused on the younger Alzheimer's patient because they're stopping the progression of the disease. These are extremely expensive treatments. And, they're generally infusions, not prescriptions that you would actually take, but they're considered prescriptions and they are extremely expensive. So while that's doing a lot of good, it is driving up healthcare costs for others just by the time you kind of average it all out. So, what does this mean for you? On a whole, I would just recommend anyone on one of these plans just assume you're going to get an increase in premium. Just assume that. The majority of people are. Hopefully, you won't, but just plan that you will. And I know the financial strain and just stress that this can cause a lot of people as their premiums increase, especially if you do have unexpected medical expenses throughout the year. Likewise, I also know a lot of people are finding it more and more difficult to afford their premiums and then pay for the actual care when they use it with deductibles and whatnot. Some people are choosing to go uninsured and just opt for higher deductibles and whatnot. I would really encourage you to look at the option that works for you. 89% of people on these ACA plans are eligible for a premium tax credit, which helps reduce their monthly premium. You know, Tax credits are incredibly helpful for folks on this plan, and there's something I want to talk about here just for a few minutes. So, with premium tax credits, these are based on your modified adjusted gross income. They don't have anything to do with your net worth or anything along that lines. It's the modified adjusted gross income. And while you can update this throughout the year, most people choose to update this number in the fall when you're, checking your plan for the following year. So as you go through your process to renew your plan or look at another option for 2025, I would really encourage you to try to assess what you think your modified adjusted gross income will be for 25, because that does drive how much money you can receive towards that premium in those premium tax credits. Now, the important thing to note here is that this is all kind of balanced out and they check what your actual income was based on what you estimated it to be for your taxes every year. So when you file your tax return, it will either, provide more money back or ask you to pay more if you were far off what you said that your modified adjusted gross income would be. So I just really recommend you kind of take a look at what you truly think it'll be and move forward with that for next year so that you can get that premium break, as well as you're not going to see have to pay a bunch of money when you file your taxes the following year. So, to kind of put a bow on the premium tax credits thing, I do want to mention that I don't know about you. I am not a CPA. I do not like taxes. I don't know much about them. I just know that we have to pay them. So I would highly recommend that if you are on one of these plans, talk to your tax professional if you have one about this situation. Make sure that as you go through this process in the fall, that you're putting as close as you can to the accurate information in so that you don't get a surprise, come April 15th. But I just have seen how complicated this can get. So help is available to you. I just really recommend that you take access of this help. All right. So a few tips that I would recommend for you as you go through this process. We're staring down the fall and looking at these plans for 2025. Playing along still with the premium tax credit discussion. One thing I didn't mention and I think is important to keep in mind is the number of family members that you have. If you had a baby, if you had a child turn 26, that number of family members, it does directly impact the amount of premium tax credit, because if you have more family members or less, that's going to impact the income thresholds that drive that tax credit that you receive monthly. So I'd really encourage you to take a look at that. Second would be, the expenses. As these things continue to increase, I know everything costs more. Health insurance is so important. I would highly recommend that if you have access to a health savings account, if you have an HSA with your plan, try to dump more money in there, because that is pre-tax, and just see what you can do to make sure that you maintain your coverage. And then the third is just review your plan for next year. Open enrollment is November 1st through January 15th. That said, you do need to enroll in a plan by December 15th to have it be active on January 1st. So if you don't enroll until January 15th, that plan wouldn't come into effect until February 1st. So just 3 important tips for you to keep in mind as you go through this process this fall and look at all of your options. So to kind of wrap this up, I know that the increases in premium, it can really be challenging for a lot of people. I would just really encourage you to look at your needs and make sure that you're on an option that truly works for you. The amount of people that are continuing to enroll in these plans every year is just increasing by millions. So there are experts available to help you. We're here if you're interested. We are here and we can help you. But truly, just make sure that your option works for you for next year.